Welcome, everyone, to the second episode of CJDH Between the Lines, a video interview series that supports evidence-informed dental hygiene practice by highlighting recently published research and exploring the passions of the authors behind those studies. I'm Salmi Levine, scientific editor of the Canadian Journal of Dental Hygiene, and I'm here today with Tammy Marshall-Paquin, a public health dental hygienist, educator, and clinic manager in Vermont, who is one of the authors of a very interesting article published in the journal late last year. Her article reported the results of a survey of Canadian and American dental hygienists about their knowledge, attitudes, and willingness to treat transgender clients. I hope you'll all take the time to read the full article, either in English or French later. Today, we'll be speaking about Tammy's research, her experience working with this vulnerable population, and her recommendations for creating culturally safe clinical practices. Welcome, Tammy.
Thank you for having me.
Our pleasure. Tammy, tell us a little bit about yourself and what inspired you to undertake this research.
So, as a public health dental hygienist in Vermont, I work with underserved populations, vulnerable populations. Also in my time at Forsyth School of Dental Hygiene, we worked with a lot of vulnerable populations. I was also very honored and privileged to edit the ancillary materials for Wilkins' 14th edition, where again, learned more about vulnerable populations. But the reason I got into this research was because I had a patient early on in my career who is transgender, and I honestly wasn't able to tell them if the gingivitis they had was related to the gender-affirming hormonal therapy they were taking. I honestly didn't want to look either for the research because I didn't want to know anything about transgender individuals, because I had this misconception that in order to be transgender, you had to have surgery. You know, I kind of looked around, but didn't see too much. And it wasn't until later that I started knowing this patient better and learning more and really trying to dive into some of the research and say, okay, could some of these things be related? That I realized there wasn't a lot out there. But again, I still had my own issues with not wanting to see anything or learn too much. I kind of had blinders. But it was that personal journey where I said, hold it, if I'm not afraid to look up anything about another patient, be there that they might be diabetic or pregnant and there are all complications, I shouldn't be afraid to look up information about my transgender patients. It's what I do. I'm in healthcare. And I said to myself, if you aren't willing to do this research, leave the profession, if that's the point you're at. So it was kind of an awakening for me. And so when I had the chance to go on to grad school, that's when I said, this is where I want to do my research. There's nothing out there. It's a desert.
Fantastic. Well, that's amazing that you went ahead and did that, and everybody should take that as an invitation to go ahead, and you shouldn't be afraid to research what your client is all about, or research things you don't know about clients. Mm-hmm. So just to turn this around a little bit, why do you think transgender patients are often reluctant to seek treatment or tell providers that they're transgender?
So based on the 2021 US Transgender Survey and the 2019 Pulse Canada Survey, 48% of transgender individuals report at least one negative experience with their healthcare providers, which includes harassment, physical assault, being sworn at, abusive language, physical assault, including rough handling during their physical care, and actually being denied care. And 24% of transgender individuals actually avoided getting care for a needed medical condition because of that fear of mistreatment. So it's no wonder if this is what they're experiencing in medicine, they have no reason to expect that dentistry is going to be any different.
Mm-hmm. Yeah, that's very sad, isn't it?
Yeah.
What about oral health issues and conditions that should we be more aware of some things for transgender clients?
Well, with any population, there's going to be experiences and disparities that can affect their oral health care. And so, for example, 40% of LGBTQIA youth are kicked out of their homes when they come out to their families. They can end up on the street where they could end up with a high, have a higher rate of being sexually abused, assaulted, and ending up in prostitution, for example. Transgender individuals have higher rates of unemployment, poverty, denial of promotion at work, being fired. They may have lacked insurance, currently lack insurance, or lack the financial means to get dental care. And so, for example, they have higher rates of generalized anxiety and major depressive disorder, which is usually related to their gender dysphoria. 40 to 50% of transgender individuals will attempt suicide at least one time. And that inability to access fear, or the fear of accessing mental health services, means that they're more likely to self-medicate with alcohol, drugs, and/or smoking. And so as oral health professionals, we're well aware of the oral implications to alcohol use, drug use, and smoking. And should they be able to access mental health services, they may receive prescriptions for their mental health. Again, as oral professionals, we're aware that xerostomia and other complications can occur from taking these medications. LGBTQIA individuals do have higher rates of sexually transmitted infections. However, something to be aware of is that in the past 2 years in the United States, we've reached new level highs of syphilis and gonorrhea. So as oral health professionals, we shouldn't just assume that because an individual is not a member of this or assumed member of this population, that they're at lower risk. Right now, 18 to 24-year-olds in the United States are the growing number, have the highest numbers in terms of sexually transmitted infections. I'm sorry.
Wow.
And STIs with oral complications include HPV, chlamydia, gonorrhea, syphilis, herpes, and Kaposi's. Transgender individuals have a higher rates of disordered eating. And this is just like any other individual who has disordered eating. You can have tooth erosion and other oral complications. So that's something to be aware of. Members of this population also have higher rates of being sexually assaulted or abused, intimate partner violence by healthcare and by law enforcement. And again, just as in any other population, including children, we should be aware of the oral signs of sexual assault and abuse. And then in terms of gender affirming hormonal care, unfortunately, we do not have any primary peer-reviewed research on the effect that gender affirming care has on the oral cavity. So what we know is what we infer from teens, menopausal women, and individuals taking testosterone. So for example, trans females or individuals who have transitioned from being male to female may experience gingival changes like inflammation or aphthous ulcers. And then trans male individuals, an individual who's transitioned from female to male, may experience gingival changes similar to menopausal women, like burning mouth and xerostomia and gingivitis. So that's something to be aware of.
Wow, that's so interesting. What about your research shows that dental hygienists are open to treating transgender patients, but they lack a clear understanding of gender and sex identity, or they may inadvertently say things that could come across as being biased or discriminatory. Where can dental hygienists go to learn more about providing oral health care for transgender individuals or creating a culturally safe and inclusive clinical environment?
So the Canadian Journal of Dental Hygiene has published at least 2 articles on this subject. One is the preferred pronoun. My preferred pronoun is she, understanding identity and the oral health needs of transgender patients, and transforming dental practice norms. Quite frequently around Pride Month in the United States, you will see CE credits coming up towards providing care to members of the LGBTQIA community. So not necessarily transgender alone, but it does pop up. You can watch for live courses, like for example, I offer a course, but there are not a lot of courses out there. And then some great resources. And this is where, don't be afraid to Google, is the Williams Institute, glad.org. So it's GLAAD.org. the trevorproject.org, which is also has resources for LGBTQIA youth who are at risk for suicide, and the National Center for Transgender Equality. As far as making a more patient-centered experience for our for our clients, frequently, if somebody's had a good experience, if a transgender individual's had a good experience in your office, they're going to tell other individuals. But one of the first ways is make it apparent on the front door, have a safe space sticker out there. Respect pronoun use. If you aren't asking everybody what their pronouns are and you're just assuming somebody is transgender, you should ask everybody, is the bottom line. If you aren't sure though, avoid using gendered titles like Mrs., Miss, Mr., and just go with the first name. Hi, Salme, how are you today? Educate your colleagues, avoid malicious talk and rumors and gossip, whether the patient is there or not. For example, I've heard staff members say, I wonder what it's coming in as today, a guy or a girl. Human beings, number one, are not its, and that kind of talk is not professional. And also avoid gossip or joking about a person's efforts to transition. We've all had those awkward periods with makeup and clothing and other things. Transgender individuals are finding themselves in dressing and looking in a way that that identifies with the gender that they identify with. Be respectful of that. And avoid unnecessary questions. Ask yourself of any question, am I asking it out of personal curiosity or medical necessity? And if you make a mistake, this is something I've heard, I'm afraid of saying something the wrong way, so I don't say anything at all, which can come across as being phobic. I have made a mistake. I misgendered a patient who, for the first time, after knowing them using the pronouns as he the whole time, came in and we were talking and she was transitioning and she wanted her pronouns to be she. When the dentist came in, I accidentally misgendered. I said, yep, he'll be working. And I immediately stopped, put a hand on his shoulder, said, she will be working on her home care. And then the minute the dentist was gone and I could go face to face, I apologized. It's acknowledging that I made a mistake and it truly was not meant to be hurtful or to misgender you. So those are some of the big things.
That's such interesting information, just amazing. So I hope everybody's taken heed to all of these resources that Tammy's talked about. And thank you so much for chatting with me about your research. You've given us a lot to think about. It's clear that dental hygiene programs need to do more to prepare students for working with LGBTQIA clients in clinical practice. We also need more research on the oral health needs of transgender individuals. Hopefully, your research will inspire others to take up this challenge. I hope everyone who's watching will go ahead and read Tammy's article in full. I think you'll really be amazed. It's a fantastic article. If you're a member of the Canadian Dental Hygienists Association and access this video from the cdha.ca website, you'll find the article in the curriculum along with a set of self-reflection questions that will allow you to obtain a certificate of completion to use towards your quality assurance requirements. If you're not a member of CDHA, you can retrieve the article from the journal's website. Just go to www.cjdh.ca and click on Browse Issues to find the October 2023 issue in which Tammy's article appears. Thank you all for watching.
Thank you.